Another breaking input which is relevant to the HMPV virus. Maharashtra and Delhi have now issued health advisory. Maharashtra and Delhi governments have now issued health advisories in response to the detection of HMPV case in Bengaluru. This development comes as a precautionary measure to prevent the potential spread of the virus. These are the latest inputs that we are tracking from the ground. Joining us on the broadcast is our colleague Sharon. A very good morning, Sharon. Sharon, help us understand what measures will the Union Department take to prevent the potential spread of HMPV, especially in the light of recent surge in cases in China, one, and second, the case that is coming to fore from Bengaluru.
Well, when we talk about the entire HMPV in India overall, as of now, the Union Ministry has been saying that HMPV has been existing in India for the longest. So it's not something that is new. Unlike COVID-19, when COVID-19 hit India, it was in fact a very new scenario, very new situation, and to deal with it, of course, it was a very difficult situation. But when it comes to the HMPV, it has been existing in India for decades. So India is well prepared, is the statement that is coming in from the Union Health Ministry. They have also released statement about how each of the states need to look into all the measures to ensure that the infection, if it's spreading, it's contained at the right time. So when we talk about some of the states like Maharashtra, Delhi, they have come up with their own advisory. Now, I'll take you through what the DGHS, which is the Delhi Health Department, has in fact come up with the measures to ensure that HMPV infection is contained. One is that there is in fact a portal which is a health ministry portal, IHIP-Portal. So whoever is getting infected, their information, their detail need to be uploaded in this, in whichever state the influenza-like illnesses or severe acute respiratory illnesses, all these cases need to be reported in that portal. Apart from that, there needs to be all these precautions that needs to be taken, which is that they need to be isolated. If person is in fact infected with HMPV, then he or she needs to be isolated. The health staff of the facility need to be very hygienic. Hands should be washed all the time by the medical staff is of course the advisory that is coming in. Not just the Delhi advisory, but the Maharashtra advisory also says the same, that there is not a panic situation, but we need to be very careful when it comes to these measures, and they need to be followed on ground.
Right, Sharon, thank you so much for bringing in all those details. We'll continue to track the story as the day progresses and we get more updates on this. But viewers, it seems like we've hit a deja vu situation here. Will we be experiencing a familiar scenario of lockdown, isolation and efforts to contain the virus? Well, time shall tell. But right now we're slipping into a very short break. Stay tuned. We'll be back with more on the other side of this segment.